Daily Dose of Complete Health with your local chiropractor, Patrick Hogg. And have you ever really thought about spinal hygiene being a little bit like brushing your teeth? It's probably something you should be doing every day. Now, that doesn't mean that people should be visiting chiropractors or massage therapists every single day of the week. But when I talk about practicing spinal hygiene, what we're really talking about is what things should we be doing on a day-to-day basis that will basically keep the spine feeling good. And the reality is that we all know that we should be doing those little stretches or exercises or movements on a day-to-day basis that will essentially keep the body functioning at its best. In the same sense that we know that if we brush our teeth every day, we're much less likely to get the cavities that we might be suffering with if we didn't do those things. So a little bit like I'm moving around right now, actually what we know is the spine is an organ like every other organ and has some things that it desperately needs on a day-to-day basis. And really, probably the three biggest things that our spine needs is a good supply of oxygen, a good supply of nutrients, and mostly the nerves in our brain and our spinal cord need a fuel source, and it can either get most of that from carbohydrates or fats. And the last thing it needs is stimulation. Now, one of the things that is most stimulating for a spine is movement. So all of those stretches and all of those exercises that you've possibly been shown by your physio, been shown by your chiropractor, been shown by your massage therapist, there's a reason why we show you that stuff. And the main reason is that what we're trying to do is instill that good spinal hygiene. Like your dentist is trying to get you to create good dental hygiene, what we're trying to ensure is that your risks of relapse or reoccurrence or further decay in your spine is being minimized as much as we possibly can. So like I say, spinal hygiene is something we should probably be practicing every day, whether that's 10 to 15 minutes of stretching, going out for a stroll on your lunch break, making sure you're getting the right foods into your body so your body's repairing and recovering, making sure you're getting the right level of rest, making sure you're sleeping. Spinal hygiene is something that we need to all be practicing on a day-to-day basis to make sure that our bodies are functioning well. If the spine does not work, Hippocrates and Socrates have both been quoted for this. If disease pursues, first look to the spine. Guys, it's super true. When we start losing function of our bodies, when you start looking at mechanical injuries, what you start to see, and I see this with my clients, when people start developing mechanical issues, e.g. they can't move properly, their back starts to go, they start to develop other diseases and ailments. Why? Well, if someone can't move, they can't exercise, they can't pursue getting a good cardiovascular system or pulmonary system, their bone system starts to degenerate because it starts to become osteoporotic, it becomes low bone density, their cholesterol levels start to change. And this can all start from a really simple thing like throwing, I'm sorry, my stand keeps falling off, throwing our low back out. If we throw our low back out, it's super easy for then other issues to then pursue after that. So practice good spinal hygiene. Long-term health requires long-term behaviors and activities. Patrick here from Complete Health. This is Daily Dose, and we'll speak to you again very, very soon. Take care for now. Bye.